Welcome back to another episode of the Blessing Health System podcast. Today I'm joined with two of our dietitians, and we're going to talk a little bit about diabetes. Thank you guys for joining us. If you wouldn't mind to do a little introduction and just let the listeners know who you are.
Hi, my name is Jenny Soucie. I'm a dietitian at the Blessing Diabetes Center, and I've been with the center over 6 years and have a lot of experience with diabetes.
And I'm Jen Kamps. I'm the dietitian at the Blessing Wellness Center. I have been with Blessing for 7 years, and I work with diabetic patients there as well.
Awesome. Let's start with an easy one here. Can you define diabetes?
Diabetes, very simply, is the fact that our pancreas, which is the organ that makes insulin or produces it, isn't either doing one of two things. It's either A, not producing insulin, or B, the insulin it's producing isn't working very effectively. So as a result, what happens is when we don't have enough insulin, we will get an accumulation of glucose or sugar in our bloodstream. I think of insulin as a key. It opens up the cell and it allows the sugar to get into the cell. In diabetes, I either don't have a key or the key I have, it's rusty. It's not opening it up. So that's just a really simple way to, I guess, understand diabetes.
And I'm sure we've all known somebody that has struggled with diabetes before, right? And I think for a lot of people, at least, speaking for myself, it's in the back of my head, but I'm not sure exactly what the best steps are to go about prevention. Can you talk a little bit about that?
The biggest step for prevention is looking at diet, of course, and also activity, which we will be talking about. But usually when I meet with patients, I like to find out what they drink. What kinds of beverages do you consume? Because when we consume sugar-sweetened beverages such as soda, sweet tea, energy drinks, specialty coffee drinks, or even a lot of fruit juice, that is very impactful on our blood sugars and also our weight. So the number one discussion I always have with patients is, what are you drinking? Because it is truly going to have the most impact on your chances for developing diabetes and also for just keeping your blood sugars elevated.
Yeah, I was looking at a study, and it showed that if you have even just 2 cans of soda a day, you're at an increased risk of developing diabetes by 26% just by having that alone. So beverages do make a difference.
They make a huge difference, and a lot of people struggle with, changing their soda consumption or sweet tea consumption, and a lot of times I say, let's start with a realistic goal for you. Maybe you're not ready to go cold turkey, but can you start alternating? Maybe you're going to drink a water and then your soda. Maybe you're going to switch to a smaller serving of soda or sweet tea, or maybe you're going to use less sugar when you make your sweet tea. But any little change that you can make will be significant.
Yeah, and then following that, what you're drinking with, what are you eating, what are you putting on your plate? So trying to load half of your plate with vegetables to get your fiber, because fiber is going to play a role in helping prevent diabetes, among other things. So looking at what you're putting on your plate.
Yeah, and fiber is really a dietitian's, is it our, what do we call that?
Your bread and butter.
It's our bread and butter?
Yeah, that's... We're passionate about it.
We are very passionate about fiber, and the reason why we are is that when people are eating foods that are higher in fiber, they're going to actually help manage their blood sugar. They're also going to feel more satisfied and more full. It also can help reduce cholesterol and prevent some forms of cancer. So foods that are higher in fiber are, believe it or not, carbohydrate foods.
Yes.
So whole grains such as whole wheat bread, oatmeal, of course, legume beans and whole fruits. Those are the things, nuts and seeds. those are the things we want to try to encourage.
Yep, and getting your fiber from food. I get asked a lot about supplementing with fiber, and you get your fiber from supplements or your gummies, but you're not getting the vitamins and the minerals that you're getting from the food. So going food first with fiber.
Yeah. And I always use this example. Would you ever sit and eat 3 apples in one sitting?
You wouldn't do that more than once.
You wouldn't do that more than once, but yet you would be willing to maybe drink a tall glass of apple juice. So, fiber does. It fills us up, makes us feel full, so much better for us.
What are your kind of recommendations as we do approach the holidays? Maybe some tips because we all want to enjoy the holidays. We all want to be able to spend time with family and not feel like we're kind of left out of what everybody else is doing. What are some of the tips that you can kind of give people that might be struggling?
Yeah, absolutely. Number one would be not to skip meals. Some people will skip a meal during the day, anticipating a bigger meal later on, and that can backfire, especially with diabetes. You want to keep your blood sugars stable throughout the day, so you want to make sure you're eating like you typically would be.
And also just making sure that you're well hydrated and that you're going to be eating foods that you normally don't eat at the other times of the year. And it's not that we don't want you to eat them. We want you to eat them and enjoy them, but we want to encourage you to think about balance. So, for instance, can you make sure and incorporate maybe some carrot and celery sticks on your plate when you're eating Aunt So-and-so's homemade noodles or whatever it is that you really enjoy? And then also just making sure that you're well hydrated.
Yep, and keeping the portions in check. So if you want to try a lot of different things, keeping your portions smaller and where the carbohydrates are and keeping those items in check with moderation. And if you're having the party, if you're throwing the party at your house, you can make more of the healthy options. Also, if you put the fruits or the vegetables, the healthy options towards the front of the buffet table, people are going to be more apt to take those because they're up front versus if they're at the end, nobody's going to have room left for those.
Very good suggestion. And if you're invited to a party, you may think, oh, why do I want to take a vegetable tray or a fruit tray? But you will be surprised. I think, if you bring that, it's something that everyone will eat.
And you can make them fun. You can make a veggie tray look like a turkey. You can make a fruit tray look like a turkey. So you can have fun with it, and kids will be eating their fruits and vegetables then too.
If you're worried you might be at risk, what are some of the things that you guys look at in your role to determine, okay, this person is a higher risk for diabetes, or this person can just change a couple of things? Is it hereditary? Is it eating habits?
Sure. Well, of course, family history is important. Also, weight, our body weight, and activity or exercise. So if we are overweight and we sit a lot for long periods of time, what a lot of people don't realize is that when we move, our muscles like to use glucose. They like to take up extra sugar. So if we're sitting for really extended periods of time, we are also probably at risk for prediabetes and diabetes.
What are the guidelines in terms of physical activity for those patients?
So the guidelines from the American Diabetes Association are 150 minutes per week. So if you think about that, that's about 30 minutes 5 times a week. Do you have to do that all in one sitting? Not necessarily. I do think, and some of the research is actually showing that when you are sitting for about 30 or 45 minutes, it's a really good idea to get up and move for about 5 or 10 minutes. So people that do sit for long periods of time, even if they're taking a little break and getting up and moving around for 5 minutes, it can really help. Even just as we've always said, can you park a little bit farther? Can you get in a few more steps? I mean, I think sometimes we think of exercise or activity as awful, dreadful, and really it's about movement. It's about activity, finding things that you enjoy doing.
And this time of year, do your shopping in the store instead of online shopping. That's going to help you get those extra steps.
Whenever we talk about a support system for somebody, what are some of the things you can do as a family member or a close friend of somebody that you're worried about?
That's tough. It's really hard because it is true that I think a lot of times we have to get ready personally to make those changes. But I do think families can be supportive. If there's a lot of snack foods in the house, for instance, do we need so many? So I really, really encourage people to look and see what's in the house. And can you decrease some of those things? Can you swap out? So if you always buy cookies, could you maybe throw in a couple of apples, or could you maybe swap out a few things so you don't have so many of those, I think, tempting types of foods in the house? If they're there, you're going to want to eat them. You really are. So just being, I think, also supportive and not being judgmental and asking, hey, how can I help? If the family is trying to help, but they're drinking regular soda or sweet tea, I do think sometimes,
doing it together,
Doing
not
it
feeling
together.
like one person needs to change it all up. Everyone being willing to support them with the changes. And focusing on what we need to eat more of, even if you are on the track for diabetes, still need to be eating our fruits and our vegetables. The whole food approach is going to fill the plate up with the nutritious food, and then there's not as much room for the other items.
And, I think a lot of times we always, when we're thinking about dieting or eating for diabetes or whatever the health condition might be, we are thinking, I can't eat this and I can't have that. I'm going to say to you, don't think about what you can have.
Focus on what you can.
How can you incorporate those vegetables and that whole fruit on your plate so that you, as you just said, Jen, can keep the portion of that mac and cheese or that spaghetti or that pizza more in check? Because if the only thing on your plate is spaghetti for dinner, you're going to eat a lot of it. Mm-hmm. But now, hey, I'm going to try to eat that salad first, and then I'm going to treat that spaghetti almost as a side dish. Mm-hmm. Sounds silly, highly effective.
Mm-hmm. And then you don't feel deprived either when you're focusing on what you need to eat more of.
Right.
So what does a good day of eating look like for somebody? Could you go through a couple examples, maybe like a breakfast, a lunch, a dinner?
Well, breakfast is super important, wanting to not skip that. So having something is better than having nothing at breakfast. And then when you establish that habit and focus on what the something is, focusing on getting fiber, getting some protein in first thing in the morning. Like oatmeal, having yogurt with it, having some kind of eggs with whole wheat toast, smoothie.
Yep. Even if you're in a hurry, some whole grain toast with a little peanut butter, or maybe some whole grain toast with a little peanut butter and a little serving of fruit. I mean, I try to encourage at breakfast that you not just eat carbs, because typically breakfast is a carbohydrate type of meal. Mm-hmm. We might eat bread or toast or cereal or an English muffin. That's not going to stick with us very long. So when we add, again, it's about adding.
Yep.
When we incorporate an egg or egg substitute or some peanut butter or some nuts or even string cheese, all good. It's going to help us stay full longer.
Yep, and if you can piece together a couple food groups, that's going to help you get your balance and get your variety and give you that fiber and then protein, depending on what food groups you're putting together.
Yeah. And then lunch and dinner, I mean, essentially that is going to vary for people a lot. But again, if you think, I'm dieting, I'm just going to have my little diet drink for breakfast, and then I'm going to eat a salad for lunch, and then guess what happens when you get home at night? Boom.
Boom. Starving.
Starving.
Yep.
So if you're going to do a salad for lunch, you should eat, of course, some protein. You should have some fruit or some whole grain crackers. Or again, you want to be thinking about having more than just one food at that time.
Absolutely.
And dinner time, I think the big thing there is just watching your portions of your protein, thinking about the palm of your hand, having those veggies, and then you're going to have maybe a side of some type of a starch. Mm-hmm. That's fine. Mm-hmm. All good.
And then trying to have a plan for your meals. That really helps take the stress away. Like in the evening, you might have had good intentions to make a very delicious and healthy meal, but with stress and a long day and you get home and you just don't feel like it, then we are grabbing the convenient items that aren't as healthy.
Right. Or if we do have a lot of, high-calorie snacks in the house. Oh, I'll just have a couple of cookies while I'm thinking about what to make for dinner.
Exactly.
And then you are not hungry for dinner.
Yep.
So let's talk about snacks.
Yeah.
String cheese, whole grain crackers, apple with peanut butter.
Yep. Whatever food groups tend to not make it to your plate for meals, that's what I try to focus on for snacks to fill in those holes nutritionally. But just really having anything that's healthy that you have is going to help.
Right. Half of a sandwich, popcorn.
Yeah, it can really be anything.
Yep.
Are snacks one of those big things that's difficult for them, or what are some of those common difficulties that they face?
The number one conversation I have with people is on beverages, and the number two conversation I have is snacking at night.
Yes, or
Yeah.
eating that evening meal late, like
Yeah.
super late. So trying not to have that happen all the time.
Right. And so a lot of times what ends up happening is that we've had a busy day and we come home and maybe we put our feet up and we're relaxing. And one of the ways that we relax is to eat or snack in front of the TV or in front of the computer or while we're reading. Or so I'm not opposed to you having a snack at night, but to be mindful about, okay, I'm having this snack, I'm going to enjoy it, and then I'm going to maybe watch TV or do whatever. But when I'm eating and doing an activity at the same time.
You're distracted and you have no idea the volume that you are consuming.
Right.
Yeah, so like on a diet recall, you have no idea what the portion size was because you were mindlessly eating at that moment.
Right. I mean, we both know that grapes are great, but unfortunately, if we get home and we open the bag and jump in while we're watching TV, that's not good either.
Mm-hmm.
Diet versus regular soda, or sweet tea versus maybe it's sweet but it's zero sugar. What kind of things do you watch out for in that kind of world?
Sure, that's a very good question. A lot of people think that regular soda or using regular sugar is better. I disagree. When you have diabetes and even for overall health, sugar is not such a good thing. When we look at non-nutritive sweeteners like stevia or Splenda, what we know about them is that they are tested pretty thoroughly and they're very dose dependent. So if someone's having one or two maybe diet sodas a day, they're probably not consuming what I would consider an excessive amount of that type of sweetener. Now, I'm not going to lie. I do try to encourage that you drink water as your primary beverage. But if you want, a diet soda or you want to have an unsweetened tea with a little stevia in it, that's still considered acceptable. And it will be so much better for your blood sugar. There's just no comparison.
Thank you both for coming out and talking with us today. For our listeners, if you'd like to learn more about diabetes care at Blessing, please visit blessinghealth.org/diabetes.